Good morning, everyone. Welcome to Wellness Wednesday series. For those who don't know me, my name is Dr. Regina. I'm a founder and CEO of Mobile Care Physical Therapy. Today, I would like to speak about something for some maybe very basic and simple, and be like, we know that. But for some, it could be very new, and I hope that is beneficial information and educational. And let's get to it. So today's topic is what is physical therapy and who we are. What do we do? Physical therapy is a rehabilitative process that helps patients and people in general with their illnesses and injuries that limit their abilities to move and perform daily activities. What happens is physical therapist takes an individual's history and physical examination and arrives to a diagnosis, which leads to a management plan where we design an individual exercise program, we provide education, and when necessary, we give manual therapy, manipulation, if we need to use an equipment such as, when necessary, traction, depending on the diagnosis. Physical modalities such as heat, cold, ultrasound, electric stimulation, assistive devices like cane, walkers. We provide education on the use of them, prosthetics and orthotics, and many, many other things. These are the majority of the interventions that we do. Physical therapy is appropriate for many different types of people, ranging from infancy to elderly. Physical therapy has many specialties and more recently subspecialty, and I will go in as much detail as I can. Specialties could include musculoskeletal, orthopedics, cardiopulmonary, neurology, endocrinology, geriatrics, pediatrics, women's health, wound care, and there's also subspecialties where just alone in orthopedics, we can have sports physical therapists who subspecialize in sports, and there are physical therapists that only treat runners, only treat dancers, only treat golfers, only treat runners, swimmers, or any type of specific sport. They specialize in it. There's also lymphedema therapists, which is involving cancer patients, wound care, which is patients with vascular issues, their arteries and veins. What else? Pediatrics. There are therapists that only treat kids from 0 to 3. There's an early intervention program, or kids ages 3 to 5. Kids, pediatric population that are only dancers, pediatric population that is just having orthopedic issues or after surgeries. So there's so many subspecialties. There's also a lot of different settings where, such as hospitals, nursing homes, extended care facilities, outpatient clinics, gyms, privately owned orthopedics, neurological facilities. What else? There's also corporate offices where therapists are specializing in assessing posture and ergonomics. There's also, I mentioned gyms already. What else? Health and fitness, like wellness centers. I think that's the majority of them. There's also physical therapists that specialize in wellness and fitness training, which means this is where patients are either preventing the injuries from happening, or those that went through rehabilitation and they just want later on a tune-up, or people that whose function is threatened by aging, injury, diseases, or environmental factors. They would like to, prevent things from happening. For elderly, for example, preventing falls. For those that have physical work, preventing and having that wellness and fitness training for back pain or other injuries, or shoulder injuries. For example, I had many patients who are hairdressers, and they do the blow dries, and their arms are always here. So shoulder injury prevention is huge in that population. Any type of spa workers that sit a lot, we do back pain prevention and screening. So there's a lot of different areas that physical therapists practice. I just wanted to also talk about the education that we go through. We go through college education before we get to PT school, which is getting bachelor's in science. That's 4 years. And then 3 years of PT school of intense and very extensive schooling. Still remember those days after 15 plus years of practicing. So, we're trained to evaluate comprehensively, and also trained to really identify and screen for red flags, which means red flags is something that the patient comes with a specific complaint, and after evaluation and physical examination, we find that a patient is not appropriate for physical therapy, and there is something that needs either urgent or very, like a medical attention, where we send them back to the doctor and for more testing, more screening, and more treatment. Many studies show that we as physical therapists can serve as primary care providers. It's very true because of the training that we get, in addition to the fact that physical therapy is a direct access, which means that you don't have to wait to see the doctor or a specialist. If you've got some complaint of pain or movement limitation, you can straight go to physical therapist. If a physical therapist that specializes in the area where your complaint is, you can definitely contact them straight away. And majority of the physical therapists do not have a wait list of scheduling to wait to see them for 2 weeks, like it is for a doctor or orthopedic or surgeon. So with that, you're saving time, money, and getting treatment already for real relief. So that's my whole spiel for that, who we are, what we do, and how we do things. I'm hoping to come up every Wednesday for, educational or clinical topics. Hopefully that will serve and be beneficial for a lot of you. Please check out my page on Facebook, Mobile Care PT. We are on Instagram, Mobile Care PT. We're also on YouTube. I'm going to be posting a lot of videos there. On YouTube, we are Mobile Care PT as well. I also have a support group for back pain, neck pain, and sciatica on here on Facebook. So please join and get as much of information as you can and need. We're here to help you. With any questions, please contact us at any time. Thank you. Be well, be safe, and I will see you next time. Take care.